Hello, I'm Paul Zajcik, founder of Elastic Steel Method of Athletic Conditioning. Today I would like to get back to basics and talk about a crunch. Crunch is an abdominal exercise. Most people do this exercise to train the erectus abdominis. It trains certain other muscles as well, but primarily the erectus abdominis. For most people, the goal to work this muscle is either to develop a six-pack, which is to make the abdominal muscle stand out, or to train the abdominal muscles to protect the back and stabilize the midsection. In a very few sports, you have abdominal muscles actually used in a game. For instance, grapplers playing the bottom positions need to come up quickly to break the posture, so they need quick abdominal contraction. However, very often the abdominals should be contracted slowly, keeping the muscles in balance. Okay? Crunch is a good exercise for that, a very basic crunch. Over the years I noticed that a lot of people do not exactly understand how to do the crunch. They see the basic movement, but they do not see certain things, and those things are missed very often. So I would like once again get back to basics and talk about that very basic point, how to do a crunch. Okay? So for a crunch, you lie down on your back. Okay, your knees are bent, your feet are flat. You can keep your hands here, you can keep your hands here behind your head, whatever you like. Okay? Now, a very basic point about a crunch is this. If you come up, the abdominals contract. However, if you come down, the abdominals relax and your body is not completely on the floor. Okay? The reason that happens in a lot of people is that there's a space here. Okay? The fact that the space is here increases the fulcrum up. Okay, so the fulcrum is up here and not down here. Okay, when the fulcrum is this high, you only begin to feel the crunch when you already came up a little bit. So you don't get full range of motion contraction for your abdominals. To prevent that from happening, you have to contract your abdominals and tilt your pelvis the whole time, whether you're doing the crunch or you're not doing the crunch. Your body is on the floor or your body is up. Okay? You have to tilt the pelvis back, okay, and contract your abdominals this way. And this is also very important for what you train for what a lot of people train for, which is to help the abdominals stabilize the whole body. Train the abdominal muscles to stabilize the midsection, protect the back. So what you want to do here, you want to eliminate this space to begin with. Contracting the abdominals, pressing the small of your back or the lower back into the floor. Keeping this contraction all the time. This by itself is going to get your abdominals to be contracted already. This will also help for your abdominals to work in full range of motion from the floor all the way up. Okay? So from here, contract the abdominals, lower back into the floor, and on the exhale, very slowly come up. And very slowly come down. Okay? Now, if you don't support your neck, that doesn't mean that you're going to injure your neck. Okay? You're going to feel the strain in your neck, but your neck is part of your cervical spine. Okay? So training your cervical spine is important as well. However, if your trainers or instructors tell you to keep your hands behind your head, and they insist, you can do that as well. Okay? So one more time, very slowly, feeling the whole movement. It's a small movement, so you have to do it very slowly to keep all the range of motions, to keep the whole distance, although it's a small distance, but to keep the whole contraction and control, you have to do it very slowly. So here we exhale, come up. Once again, make sure this does not happen. If this happens, you're shifting the fulcrum. Okay? Keep your lower back pressed into the floor. Coming up. Coming down. Now there's a tendency to release. Don't release. Now if your neck feels too tight, you can place your head on one side. Stretch the neck for a little bit, turn it to the other side. Stretch your neck for a little bit. Okay, that's a very common problem. And one more thing, the lower back. Very often, if you start to do your crunches this way, you haven't done it this way before, okay, with a posterior tilt, you're going to feel something in your back. And very often people think that they're hurting their back and they rather not do the crunches this way. What really is happening is your psoas is attached to your spine, okay? And this movement slightly stretches your psoas. So by doing this and coming up, feeling something in your back, usually what you're feeling is your psoas muscles, okay, stretching. Stretching your psoas is a good thing. There's a very minor stretch, but it's there, okay? So that is basic crunch. Going over it again, very simple. Keep your lower back on the floor. If your fingers can fit under your back, that's not a good idea. Do not perform the crunches this way. Do not perform the crunches where you start this way and later on you press your lower back into the floor, okay? The whole time your lower back must be on the floor using your abdominal muscles by tilting your pelvis, okay? And then as you exhale slowly with full control, come up and very slowly with full control come down. If you do the exercise slowly and if you keep your lower back pressed into the floor, your numbers will decrease. It doesn't matter. Remember, quality over quantity.